Welcome back to Learning Anatomy with Dr. Bakari. And if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the common fibular nerve. The common fibular nerve can also be referred to as the common peroneal nerve. This is one of the terminal branches of the sciatic nerve. If you try to use this image by the side here for illustration, this structure that is harrowed here in black is the sciatic nerve. And the sciatic nerve at its terminal end will be structurally divided into the tibial nerve that is harrowed here in red, and also the common fibular nerve that is harrowed here in purple. So you see the sciatic nerve terminally dividing into the tibial nerve and also the common fibular nerve. So write down with me as I unfold the path through which the common fibular nerve runs and also the different branches that it gives along that course. Before driving it into the part of the common fibular nerve and also the branches that it gives along the path that it runs, let's use this slide to summarize the general innervations that the common fibular nerve provides along this region. So if we try to use this image by the side for illustration, this is where we say we have the sciatic nerve that is harrowed here in black. And we say that the sciatic nerve will terminally divide into the tibial nerve that is harrowed in red, and also the common fibular nerve that is harrowed here in blue. So the common fibular nerve is seen to provide innervations for different regions in the lower limb. So let's try and use this slide to establish or illustrate the different regions that the common fibular nerve provides innervations for. So the common fibular nerve is seen to provide motor innervations and also sensory innervations. So these two types of innervations are seen to be provided by the common fibular nerve. So for the motor innervation, it is seen to provide motor innervation to just one muscle in the posterior compartment of the thigh. If you look at this image here, this is where we say we have the sciatic nerve that is harrowed here in black. At this point where we have the sciatic nerve, structurally, what is contained within this space is the root of the common fibular nerve and also the tibial nerve, packed in a single sheet. So at this point, we have the common fibular component of the sciatic nerve, giving off an innervation here that is highlighted in dotted red. And this innervation is solely to provide motor innervation for the short head of the biceps femoris. This is one of the muscles located in the posterior thigh region. And of course, this is the posterior compartment of the lower limb. And it is around the posterior region that we have the sciatic nerve, of course, running through. It's also seen to provide motor innervations for muscles in both the lateral and also the anterior regions of the leg. If you go more inferior to the thigh region, the next region in the lower limb is the leg. And if you look at the common fibular nerve at this region, it is seen to provide motor innervations for muscles that are located in the lateral compartment of the leg and also the anterior compartment of the leg. So it is these two sub-regions of the leg that the common fibular nerve is seen to provide motor innervations for. While the tibial nerve is seen to provide motor innervations for the muscles in the posterior compartment of the leg. You can see that the different compartments of the leg have been taken off by different nerves. So it's good for us to be able to highlight this. It's also seen to provide motor innervations for some intrinsic muscles of the foot. And this is what is seen to be highlighted also here in dotted red. So you see that the motor innervations are given to muscles in the different regions of the lower limb. In the thigh, we have it providing motor innervation for just one muscle, while in the leg, it is seen to provide motor innervations for muscles in the lateral and the anterior compartment of the leg. Also in the foot region, it is also seen to provide motor innervations for some intrinsic muscles of the foot. And as we go through with this lecture, we'll be seeing the specific branches that will emerge from the common fibular nerve and will be giving motor innervations to these specific regions. Also for sensory innervation, it is seen to provide sensory innervations for the anterolateral region of the leg. And if you look at the emergence of the common fibular nerve at this region, this is where we have the sensory innervation also represented or shown in dotted red. And you see it providing sensory innervations for the anterolateral region of the leg. It's also seen to provide sensory innervation for the bulk of the dorsum of the foot. This is where we have the foot, and this is where you have the emergence of the sensory innervation here, also highlighted in dotted red. Of course, providing sensory innervations for the dorsum of the foot. And also to add, we have the formation of the sural nerve. This sural nerve also contributes to the sensory supply or innervations of the lower limb. The sural nerve is formed from contributory branch from both the tibial nerve and also the common fibular nerve. So you see the tibial nerve and the common fibular nerve contributing to the formation of the sural nerve. And this sural nerve is also seen to provide sensory innervations for the posterolateral region of the leg. The sural nerve also provides sensory innervations for the lateral region of the foot. This is how we have different branches emerging from the common fibular nerve to provide both sensory and also motor innervations for different regions of the lower limb. So how does the common fibular nerve emerge? We say that the common fibular nerve is seen to emerge from the sciatic nerve. Of course, structurally, it is seen to be contained in a single sheath with the tibial nerve. And this is where we have the formation of the sciatic nerve. So in establishing the basis behind the formation of the common fibular nerve, we say that the common fibular nerve or the peroneal nerve is formed from the dorsal divisions of the anterior rami from L4, L5, S1, and also S2. If you try to use this image down here for illustration, this is where we have the configuration of the anterior rami from L4, L5, S1, S2, S3, and so on. And if you look at this anterior rami, we see that the anterior rami is further subdivided into ventral divisions or ventral branches or dorsal divisions or dorsal branches. If you look at the ventral divisions here, you see that it is highlighted here in red, and the dorsal divisions here are highlighted in blue. So from the dorsal divisions is where we have the emergence of the common fibular nerve. And we say that the common fibular nerve would emerge from the dorsal divisions of the anterior rami from L4, L5, S1, and S2. And this is where we have the emergence here at this point that is parodied here in yellow. This is where we have the root of the common fibular nerve. The root of the common fibular nerve will be seen to unite with the root of the tibial nerve. And at this other side here is where we have the ventral divisions. The tibial nerve is seen to emerge from the ventral divisions of the anterior rami of L4, L5, S1, S2, and also S3. And at this point here is where we have the emergence of the root of the tibial nerve. So you see that these two roots, which include the root of the common fibular nerve and also the root of the tibial nerve, will unite at this point that is parodied here in black to form the sciatic nerve. This sciatic nerve, they merge within the pelvic cavity. So of course, it will need to pass through it for it to exit the pelvic cavity, because this sciatic nerve is not needed within the pelvic cavity. It is needed to provide innervations for the lower limb. So if we try to use this image up here, you see that we have the sciatic nerve. After its emergence within the pelvic cavity, you see it passing through the greater sciatic foramen. And this is what is seen to be parodied here in blue. And going through the basis behind the formation of the greater sciatic foramen, we've tried to highlight this in our lecture on the bony pelvics. If you've not checked up that lecture, please kindly go and do so. In that lecture, we describe or established that the greater sciatic notch is transformed into the greater sciatic foramen. And the structure that is responsible for this transformation is the sacrospinous ligament. This sacrospinous ligament is seen here to be highlighted here in black. Just as the name implies, the sacrospinous ligament. It is seen to connect the spine of the ischium to the sacrum. And the sacrospinous ligament running through this course is seen to transform the greater sciatic notch, which is more like an indentation, into the greater sciatic foramen. And upon the formation of this foramen, we have the sciatic nerve passing through it. So we have the sciatic nerve here, arrowed in yellow, and this sciatic nerve is seen to pass through the greater sciatic foramen. And it is through this cause that it is able to then access the posterior region of the lower limb. The sciatic nerve is formed within the pelvic cavity, and it is formed by the union of the roots of the common fibular nerve and also the tibial nerve. And after its formation, it needs to exit the pelvic cavity. And it does that through the greater sciatic foramen. And through this foramen, you now see it being able to access the posterior region of the lower limb. And this is what is seen to be parodial at this point. And as this sciatic nerve runs, it is structurally made up of two roots, which include the root of the common fibular nerve and also the root of the tibial nerve. And these two nerves, the roots, are structurally contained in a single sheet. So you see it running along this course until when it gets to the upper border of the popliteal fossa. And it is at this point that it divides into two nerves. Then we have the tibial nerve, which of course is bigger or larger in size. Then we have the common fibular nerve, which of course is smaller in size. And this is what is seen to be parodial in purple. The sciatic nerve, which is made up of the two roots that are structurally contained in a single sheet, are finally divided or terminated into the tibial nerve on the medial side and also the common fibular nerve on the lateral side. It is always good for us to keep the image in an anatomical position so that it will be easy for us to understand. So if you look at this medial region, it's where we have the emergence of the tibial nerve. And it is along this course that the tibial nerve would run. And also on the lateral side, we have the common fibular nerve or the peroneal nerve. And it's also along this course that the common fibular nerve would also run. So let's drive further to see the course of the common fibular nerve and also the different branches that it's seen to emerge from it. So driving through, we'll be looking at the common fibular nerve around the thigh region. Remember in our previous slide, we tried to establish that the common fibular nerve and the tibial nerve, these two nerves have roots that are contained in a single sheet. And at this region, they are referred to as the sciatic nerve. If you look at this image here, this is where we have the sciatic nerve that is arrowed in purple. So at this region that is arrowed in purple, it is seen to give up a nerve to supply one of the muscles of the posterior region of the thigh. This is where we have the popliteal fossa, and the common fibular portion or the common fibular component of the sciatic nerve is seen to give off a nerve that would innervate the short head of the biceps femoris. And this nerve is given off close to the popliteal fossa. So this is what is seen to be highlighted here. If you go back to our lecture on the tibial nerve, in that lecture we described that the tibial component of the sciatic nerve at the region of the thigh is seen to provide motor innervations for the hamstring muscles, except the short head of the biceps femoris. And this short head is what is taken up by the common fibular component of the sciatic nerve. So let's drive down to other regions of the lower limb to see the other branches that will emerge from the common fibular nerve or the peroneal nerve. So going to the region of the popliteal fossa. So if we try to use this image for illustration, this structure that is arrowed here in green is the sciatic nerve. At the upper part of the popliteal fossa, you see the sciatic nerve terminally dividing into the tibial nerve on the medial side and the common fibular nerve on the lateral side. So this is the medial side and this is the lateral side. And as the common fibular nerve emerges from the sciatic nerve, you see it to part obliquely along the popliteal fossa. So it descends obliquely along the popliteal fossa, and you see it at the lateral side. This nerve, you see it to part along the tendon of the biceps femoris, and also the lateral head of the gastrocnemius. If you look at this image here that is highlighted at this point, this is the tendon of the biceps femoris, and you see the common fibular nerve after its emergence. You see it parting along the course of the tendon of the biceps femoris, and also the lateral head of the gastrocnemius. And this is what is seen to be highlighted here in yellow. So you see these two muscles, they have a close relationship with the path through which the common fibular nerve would run after its emergence. Going back to the common fibular nerve and also the branches that it gives along this course. The first branch that emerges from the common fibular nerve or the peroneal nerve along this course are articular branches. And these articular branches are seen to be highlighted here in red. These branches are seen to innervate the joint around this region. So they are seen to provide innervations for the knee joint. Then another set of nerve that is seen to emerge from the common fibular nerve within the popliteal fossa is the lateral and the communicating supracutaneous nerve. The lateral supracutaneous nerve is what is seen here to be highlighted in green, and you see it emerging from the common fibular nerve at this point. Then we also have the emergence of the communicating supracutaneous nerve that is highlighted here in dotted blue. This communicating supracutaneous nerve is seen to structurally connect the medial supracutaneous nerve and also the lateral supracutaneous nerve. The medial supracutaneous nerve is seen as an emergence of the tibial nerve within the popliteal fossa. This we've tried to highlight during our lecture on the tibial nerve. If you've not checked that lecture out, please kindly go and do so to keep yourself updated. In that lecture, we said that the tibial nerve will give off the medial supracutaneous nerve. And this medial supracutaneous nerve is seen to be highlighted here in pink at this region. And this nerve is seen to unite with the lateral supracutaneous nerve that emerges from the common fibular nerve. And we have a communicating supracutaneous nerve, creating a linkage between the medial and the lateral supracutaneous nerve. And this is where we then have the emergence of the sural nerve that is highlighted here in purple. The sural nerve is a sensory nerve, and it's seen to provide sensory innervation for the posterolateral region of the leg. So at its emergence here, around the distal half of the leg, you see it providing sensory innervation for the skin around the posterolateral region of the leg. We now see that the tibial nerve and the common fibular nerve are giving contributory branches to form the sural nerve. And we tried to highlight this when we started this lecture, that we also have the common fibular nerve contributing to the formation of the sural nerve. So it's good for us to highlight this at this point. In some tests, the communicating supracutaneous nerve can be stated to be an emergence from the lateral supracutaneous nerve, while some tests would describe the communicating supracutaneous nerve as a direct emergence from the trunk of the common fibular nerve. So it actually depends on the test that we are reading, but it's good for us to take note of this, that the communicating supracutaneous nerve is to link or connect the medial and the lateral supracutaneous nerve. All in all is in the quest of forming the sural nerve. And this is the sural nerve here, heralded in purple. So in the formation of the sural nerve, we have a number of sub-nerves coming together. So we have the lateral supracutaneous nerve here, heralded in black, of course, an emergence of the common fibular nerve. Then we have the medial supracutaneous nerve that is also heralded in black, and this is an emergence of the tibial nerve. Then we have the supracommunicating nerve that is also heralded in black. So a collection of this number of nerves are referred to as the sural nerve complex. So the sural nerve complex will come together all in the quest of forming the sural nerve. So these are the branches that are seen to emerge from the common fibular nerve or the peroneal nerve within the popliteal fossa. So going further, also within the popliteal fossa, this is where we have the common fibular nerve that is heralded in blue. And we say that this nerve is an emergence of the sciatic nerve. We say that within the popliteal fossa, it is seen to give off the articular branches here that is heralded in red. It is also seen to give off the lateral supracutaneous nerve that is heralded in green. Then we also have an emergence that is referred to as the communicating supracutaneous nerve that is highlighted here in dotted blue. We already described the function of the communicating supracutaneous nerve in the formation of the sural nerve. This is what is seen to be highlighted here in purple. So after the emergence of this nerve, which are the articular branches, and also the lateral and the communicating supracutaneous nerve, you see that the common fibular nerve is seen to wrap around the neck of the fibula. Remember, in anatomical position, this is where we have the medial side, and this is where we have the lateral side. It is on the lateral side that we have the fibula, and of course, on the medial side, we have the tibia. So you see the fibula here. This is the bony configuration around the lateral side of the leg. This is where we have the fibula here, heralded at this point. And if you look at this region, is the neck of the fibula. So you see this common fibular nerve, after giving up this number of branches within the popliteal fossa, it is now seen to wrap around the neck of the fibula. And this is what is presented here in this image. So after wrapping around the neck of the fibula, you see it finally terminating into the superficial fibular nerve, and this is what is arrowed here in black, and also the deep fibular nerve, and this is what is seen to be arrowed here in pink. So you see that after wrapping through or wrapping around the neck of the fibula, it finally terminates into a superficial branch and also a deep branch. And we'll be taking each of these branches one after the other to see the course that they run along the lower limb after their emergence. So now going through the superficial fibular nerve, the superficial fibular nerve can also be referred to as the superficial peroneal nerve. After the common fibular nerve is seen to wrap around the neck of the fibula, we say that it finally terminates into a superficial branch and also a deep branch. This slide will be looking at the superficial fibular nerve within the leg region. So let's try and use this image up here for illustration. This is where we have the emergence of the common fibular nerve. We know that the common fibular nerve is an emergence from the sciatic nerve. This common fibular nerve, after its emergence, is seen to give off a number of branches within the popliteal fossa. And after this, it is seen to wrap around the neck of the fibula. At this point, it finally gives off a superficial fibular nerve or a superficial peroneal nerve, and also a deep fibular nerve or a deep peroneal nerve. So you see these two terminal divisions of the common fibular nerve after wrapping around the neck of the fibula. And this is what is presented here in this image. So the superficial fibular nerve or the superficial peroneal nerve is seen to give off motor innervations and also sensory innervations. So along this course, you see that this nerve will run down the lower limb. As it runs down the lower limb, it is seen to give off a number of branches. And these branches are seen to provide motor innervations for muscles that are located in the lateral compartment of the leg. So in the lateral region, we have muscles that are provided with motor innervations by branches from the superficial fibular nerve. And these muscles include the fibularis brevis or the peroneus brevis. So you see a branch emerging at this point, giving motor innervation to the fibularis brevis. We also have another innervation to the fibularis longus or the peroneus longus. And this is what is seen to also be highlighted here in red. So you see these two emergence from the superficial fibular nerve, giving off motor innervations to these two muscles. And these two muscles are located in the lateral region of the leg. This superficial fibular nerve is then seen to descend further down. And as it descends further down, it's seen to give cutaneous branches. And these cutaneous branches are seen to provide sensory innervations for the skin around the anterolateral region of the leg. And this is what is seen here to be highlighted in dotted black. So you see a number of branches will emerge, of course, sensory branches, giving off cutaneous innervation for the anterolateral region of the leg. So while the superficial branch of the common fibular nerve is providing sensory innervations for the anterolateral region of the leg, remember that the sural nerve around the leg region is seen to provide sensory innervations or cutaneous innervations for the posterolateral region of the leg. So you can see how the different regions of the leg are being taken up by different nerves. So this is how the superficial fibular nerve or the peroneal nerve would cause giving off motor and also sensory innervations. So let's drive further to see the cause of the superficial fibular nerve around the foot region. We've tried to establish in our previous slide that the superficial fibular nerve or the superficial peroneal nerve is seen to give off motor innervations to the muscles in the lateral compartment of the leg and also sensory innervations to the anterolateral region of the leg. So as it drives down to reach the region of the foot, let's see the innervations that it will give around this region. And this is where we have the superficial fibular nerve that is arrowed here in red. So around the border between the superior 2/3 and inferior 1/3 of the leg, let's use this arrow to mark that limit. It's demarcated as the junction between the superior 2/3 and inferior 1/3 of the leg. And at this region, we have the superficial fibular nerve piercing the deep crural fascia. This is the deep crural fascia here highlighted in blue. This deep crural fascia is located at the superficial part. It is the fascia that is seen to surround the muscles of the leg. So you see the superficial fibular nerve of course, driving more superficially, and at this region is able to pierce the deep crural fascia. So as it pierces the deep crural fascia, you see it finally terminating into the medial and also the lateral branches. These medial and lateral branches are seen to provide cutaneous innervation for the dorsum of the foot. And the exception of this region is the first web space. So you see that all this region here that is highlighted or demarcated here in blue are provided sensory innervations for by the superficial fibular nerve, except this region that is highlighted here in red. But the bulk of the dorsum of the foot is provided sensory innervation by the superficial fibular nerve. And this is what is captured here in this image. So these are the branches that are seen to emerge from the superficial fibular nerve or the peroneal nerve around the foot region. And if you look at this medial hand here that is highlighted here in black, we have the sensory innervation provided by the saphenous nerve. The saphenous nerve is a branch from the femoral nerve. And if you drive to the lateral hand here, the lateral edge of the foot is provided sensory innervation for by the sural nerve. We already established how the sural nerve is formed during the course of this lecture. The sural nerve is formed from contribution from the tibia and also the common fibular nerve. And we know that the sural nerve is a solely sensory nerve and it's seen to provide sensory innervation for the lateral edge of the foot. Why the sensory innervation of this region that is harrowed here in red, which of course is the skin around the first web space, the sensory innervation of this area will be provided by the deep fibular nerve or the deep peroneal nerve. And this would highlight when we get to the deep fibular branch of the common fibular nerve. So at this region, you can see that the sensory innervation of the bulk of the dorsum of the foot is provided by the superficial fibular nerve. So let's go through the deep fibular nerve. The deep fibular nerve can also be referred to as the deep peroneal nerve. This nerve around the leg region is where we say it emerges. So let's look at the branches that it gives around this region. So using this image up here, this is where we have the common fibular nerve. We know that the common fibular nerve is an emergence of the sciatic nerve. And after its emergence from the sciatic nerve, you see it giving off articular branches, the lateral suracutaneous branch, and also the communicating suracutaneous nerve. So after giving up these branches, you see it wrapping around the neck of the fibula before it finally terminates into the superficial fibular nerve that is arrowed here in blue, and also the deep fibular nerve that is arrowed here in red. So let's drive further to see how the deep fibular nerve would run and also the branches that would emerge from it. So the deep fibular nerve is seen to run medially, and the essence of running medially is to be able to pierce the intermuscular septum. So you see it running medially, and at this point, you see it piercing the intermuscular septum. This intermuscular septum is seen to be highlighted here in black. So this intermuscular septum is seen to demarcate or separate muscles in the lateral compartment of the leg from the anterior compartment of the leg. And it is through this channel that the deep fibular nerve is able to access the anterior compartment of the leg. And as it pierces through the intermuscular septum, the deep fibular nerve is able to access the anterior compartment of the leg. And this is why the deep fibular nerve is seen to provide motor innervations for the muscles in the anterior compartment of the leg. And at this space is seen to give off motor innervations to supply muscles in the anterior compartment. So you see that this deep fibular nerve then seen to cause down, and this is what is seen to be represented here in dotted blue. So at this region is seen to give innervation for the tibialis anterior, and this is what is seen to be highlighted here in dotted red. This is also seen to provide motor innervation for extensor digitorum longus. This is what is also seen to be highlighted here in also dotted red. It also goes further to give motor innervations for the extensor hallucis longus. And this is what is seen to also be highlighted here in dotted red. And finally, it gives motor innervation to the peroneal status. This is what is also seen to be highlighted here in dotted red. So you see it giving up a number of motor branches for muscles in the anterior compartment of the leg. And we've tried to highlight how the deep fibular nerve or the deep peroneal nerve is able to access the anterior compartment of the leg. So these are the branches that are seen to emerge from the deep fibular nerve or the deep peroneal nerve along the leg. Driving further on the deep fibular or the deep peroneal nerve in the foot region, We know that after the leg, of course, the next region is the foot. So let's see what happens to the deep fibular nerve around the foot region. This deep fibular nerve, we already established the course that it runs in our previous slide in being able to access the anterior region of the leg, giving us a number of motor branches seen to be highlighted here in dotted red. So after the emergence of a number of motor branches to innervate muscles in the anterior compartment of the leg, you see it further descending down to the region of the foot. So around the foot region, it is seen to pass deep to the extensor retinaculum. And this is what is seen to be highlighted here in blue. This extensor retinaculum is like a fascia that is seen around the foot region. And it has part below it. So you see it giving off a lateral branch that is seen to be highlighted here in dotted black, and also a medial branch that is seen to be highlighted here in dotted red. Terminal branches of the deep fibular nerve after passing below or deep to the extensor retinaculum. So on the lateral side, you see it providing motor innervations for some intrinsic muscles. So you see the lateral branch of the deep fibular nerve providing motor innervation for the extensor digitorum brevis, and this is what is seen to be highlighted here in dotted red. It's also seen to provide motor innervations for the extensor hallucis brevis, which is also seen to be highlighted here in dotted red. The extensor hallucis brevis is a medial component of the extensor digitorum brevis. So in some tests, the extensor digitorum brevis may be seen as the only muscle that will be listed as a muscle that will be innervated by the lateral branch of the deep fibular nerve. But it's good for us to state it at this point so that during the course of studying, if you come across this, you would be able to relate with it. So the extensor hallucis brevis is a medial component of the extensor digitorum brevis. So after giving up these branches, it then seems to give up articular branches that is highlighted here in red. And these articular branches are seen to provide innervations for the joint around the foot region. We know that the foot is made up of a number of bones, of course, that are connected together at joints. So for the medial branch of the deep fibular nerve, which is what is seen to be highlighted here in dotted red, you see it providing sensory innervation for the skin of the first web space. And this is what is seen to be carried here in yellow. Remember in our previous slide, when we tried to describe the superficial branch of the common fibular nerve, we said that the superficial branch in the leg region is seen to provide sensory innervation for the bulk of the dorsum of the foot. And of course, it's leaving out the skin of the first web space, and this is taken up by the deep fibular nerve. So recapping on the sensory innervation of the entire region, if you look at this region that is harrowed here in blue, the sensory innervation of this region is provided by the superficial fibular nerve or the superficial peroneal nerve. We've tried to highlight this in our previous slide, where we said that the superficial fibular nerve is seen to provide sensory innervation for the bulk of the dorsum of the foot. And this is what is expressed here in this image. Of course, leaving out the skin of the first web space that will be taken up by the medial branch of the deep fibular nerve. Then if you come to the hedge here, at the medial hedge, you see that the sensory innervation is provided by the saphenous nerve. The saphenous nerve is a branch from the femoral nerve. And if you go to the other hand on the lateral side, the lateral hedge of the foot, the sensory innervation is provided by the sural nerve. By now, you should already know how the sural nerve is formed. So this is the general sensory innervation of the dorsum of the foot. So it's good for us to be able to highlight the specific regions that are innervated by specific nerves. So let's look at the clinical anatomy. We could have damage or injury to the common fibular nerve, and this basically can occur as a result of fracture to the neck of the fibula. During the course of this lecture, we try to describe the path through which the common fibular nerve wrap around the neck of the fibula. So when there's fracture around the space, we should know that it can damage the common fibular nerve. Also, impact around that region can also damage or cause injury to the common fibular nerve. But when this damage is targeted at the terminal branches of the common fibular nerve, we should expect different effects. And when this happens, specifically when there is target on the deep branch of the common fibular nerve, which is the deep fibular nerve or the deep peroneal nerve, definitely the motor actions of the anterior muscles of the leg will be affected, because we already stated during the course of this lecture that the deep fibular nerve provides motor innervation for the anterior muscles of the leg. And if there is a damage specifically or targeted to the deep fibular nerve, it's going to affect the actions of this muscle. And the actions that the anterior muscles of the leg exert include dorsiflexion. So there's going to be the inability to dorsiflex, and this will lead to foot drop. Also, when there is target on the superficial fibular nerve or the superficial peroneal nerve, this is going to be affecting the action of the muscles in the lateral compartment of the leg. Because during the course of this lecture also, we stated that the superficial fibular nerve is seen to provide motor innervations for muscles in the lateral compartment of the leg. And the actions that the lateral group of muscles in the leg will exert is eversion of the foot. So when there is damage to the superficial fibular nerve or the superficial peroneal nerve, there's going to be loss of eversion. So thanks for watching this video. Let's continue to stay glued to this channel.